welcome back to ZPTV and our Ask a Specialist series. This is Amanda in our ZPTV studio, and today I have the honor and pleasure of having Dr. Jordan Kerker of the Central Orthopedic Group. Nice to have you here.
Thank you. Thank you for having me.
My pleasure, my pleasure. So what is one of the more common injuries of the knee that you might see and treat at your office?
One of the most common things I see are ACL injuries. These are typically ligament injuries seen on the athletic playing field, mostly in sports that deal with a lot of cutting or changing direction, sports such as soccer, such as lacrosse, and football injuries.
So what would be, forgive my ignorance then, what is the function of the ACL?
So the ACL is the main ligament that stabilizes the knee. It sits right in the center portion of the knee, and it controls stability both in the front direction and rotationally within the knee. If you look at the knee, this is the patella of the knee. This is the front structure of the knee. If you bend that down and then bend the knee, you can see in the center portion of the knee you have two ligaments. These are the cruciate ligaments. There's an anterior cruciate ligament and then a posterior cruciate ligament. And the ligament we're talking about today is this anterior cruciate ligament. And this really stabilizes the knee. It prevents patients from having too much instability from front to back as well as rotational. And the reason that's important is that without an ACL and with that instability, these meniscus will get injured and torn, and that increases the stresses on the cartilage of the knee, and that's what primarily leads to early arthritis in patients without an ACL.
So how could you diagnose an ACL injury then?
A lot of these injuries can be first diagnosed at the time of the injury. A lot of patients will have a cutting injury. Typically they're pivot injuries, non-contact, and you can hear a pop in the knee. The two other ways primarily are on physical exam. The patient's knee will feel fairly loose or unstable. And then the main diagnostic test would be an MRI, and that confirms an ACL injury and looks for other concurrent injuries along with the ACL.
And we're hoping that you're sending those MRI patients to Zwanger-Pesiri, of
Absolutely.
course. So who would be a candidate for an ACL reconstruction then?
You know, really anyone who's fairly active is a candidate. These are surgeries that used to be done in fairly young people, mostly athletic patients. However, we understand now from research that a tear in the ACL creates arthritis at a very early age. So someone without arthritis, even their 50s and even early 60s, we're reconstructing their ACLs now.
Oh my goodness. So what would be maybe the standard treatment that you would use for ACL reconstruction?
So once a patient is diagnosed with an ACL injury, they typically need to undergo several weeks of preoperative physical therapy, mostly to regain function and decrease the swelling. Once that is achieved, the patients can undergo a standard ACL reconstruction, and these are done typically at an outpatient ambulatory surgery center. They're done in roughly 45 minutes to an hour, and they're done arthroscopically assisted through very small incisions.
So doctor, what would be the standard recovery time for a patient and perhaps when they could expect to go back to resume normal activity?
Right. Typically, recovery is anywhere from 6 to 9 months and really depends on the level of the function of the patient. Everyday people that just need to get back to their life or their job, typically that's about a 3 to 6 month recovery. Athletes that require a more intensive level of recovery, that's typically a 9-month process.
It seems like we've made some really great advances in the procedure to help repair that.
Yeah, typically these are done as an outpatient in an ambulatory setting. Anesthesiologists are very versed at giving nerve blocks, so the pain control is extremely effective. Patients have very little pain, they go home the same day, and they recover at home.
Well, for someone struggling through this type of an injury or post-surgery, I'm glad that we have experts like you in the field. So if a patient wanted to come and find you for come get a consult, where would they find you, doctor?
Well, they could either go to our website at www.centralorthopedicgroup.com, or you can call our office at 516-681-8822. We have 3 locations, one in Plainview, one in Brockville Center, and one in Massapequa.
So you can't be too far from a stone's throw away, so that's good stuff.
You can find me.
Excellent. Well, thank you so much for coming to the studio
You're
today.
Welcome. Thanks for having me.
And hopefully this answers a lot of your questions with our Ask a Specialist series. Today, Dr. Jordan Kerker and Amanda for ZPTV. Take care.